I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It, episode 47. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
Hey folks, Dr. Joe here. So glad we can spend a little time together, as always. I do appreciate this, by the way. If I don't say thank you enough, I mean that. You've made our radio show the number one health and wellness radio show in the country, and because of you guys listening and telling your friends, so I want to say thank you, and I probably don't say that enough. And what we're going to talk about today is supplements. And I know I talk a lot about supplements. If you listen to my shows, you know I'm always talking about supplements. And the question I want to talk about today is, are supplements safe? And the answer is, it depends. Because I read a study a while ago on melatonin. And melatonin is a chemical that's produced in your brain and helps you sleep. And the study was out that saying if you take melatonin, does it help with jet lag? And the problem comes up with the studies that I read where there's questionable results is the type of supplement you're taking, the quality. My grandfather was a German immigrant, came over in 1923 to get away from Hitler. And I came to Hoboken, New Jersey, which is where I was born and raised my first years of my life. And he came over from Germany. So he was a German working as a carpenter at the Hudson River there, fixing ships that were torpedoed. So American ships would be torpedoed. They'd come into the Hudson Harbor, Hudson Bay there, whatever it was, and he'd work on it to fix it and then send it back out to war. So here was a German in America. And a couple of things that were interesting about this, I'll tell the story. I'm going to supplements in a second. I'm going somewhere with this. Is I remember talking to him and talking to him, my grandmother, and I said, will you teach me your language? And they said, you speak our language. It's English. They were Americans. They weren't Germans anymore. They were Americans. My Italian grandparents came over a little earlier than that. They were Americans. They were Italian Americans, but they identified themselves as Americans. And so it was just an interesting thought that he was so proud of being an American and the work that he did. He was a master carpenter. And he was very proud to help in the war effort against his own country, which is pretty powerful stuff. But he used to tell me he had a few tools. And the reason I was going with this is he had not a lot of tools, but the tools he had, he would clean them after every time he'd use them. He'd sharpen them, he'd polish them, he'd hang them up, he'd dry them. And he said, Joseph, always buy the best. It's always cheaper. And I thought, what a profound statement. Always buy the best. It's always cheaper. So let's assume that I needed or you needed brain surgery. Would you go to a discount brain surgeon? No, you'd go to the best brain surgeon there was because it's your life. And you want to make sure you're getting the best you possibly can. That's where I'm going with this idea with supplements. I've read studies that vitamin C doesn't work. Vitamin C is junk. And we did studies on it, double-blind studies, whatever it was. And we found out that it doesn't help with colds or flu. When we found out years earlier that it does help with the immune system. So the question now is you're reading these two different studies giving you contradicting information, which one's right? You have to look at the quality of the supplements that they used. You always got to dig deeper. Whenever I read research, I always want to dig a little deeper. I always ask who sponsored the research? That's another one too. You know, we found out that, high fructose corn syrup is good for you, sponsored by the High Fructose Corn Syrup Society. So you want to get the quality supplements when it comes to dealing with your body working. So if you use ascorbic acid, that's 1/8 of the vitamin C molecule. Can we call that vitamin C? Absolutely. Is it truly the vitamin C that was used in the original research? No, it wasn't. So you want to use the whole supplement, the whole food supplement. Is it a synthetic versus a non-synthetic? That's a big issue too. I'm going to talk about that a little bit later. And the synthetic supplements can actually cause damage to your body. So you think you're going to save some money, and I'm going to go out and buy the cheap omega-3 fatty acids. And I'm going to take omega-3 fatty acids. I heard they're good for me. They're good for my brain. Well, it turns out that the cheap omega-3 fatty acids have a very high chance of being contaminated with things like mercury. And mercury, when it gets into the system, can short-circuit the nervous system. As a chiropractor, my job is making sure your nervous system is working at 100%, chemically and physically. So if you have pinched nerves, of course, my team of doctors, we're great at unpinching nerves. However, if you're doing things like loading your body up with mercury or high fructose corn syrup or chemicals or synthetic supplements, you may not be getting all the results that you should be getting And then you'll say, well, I went to Dr. Joe and it didn't help, or I only got some results. Well, did you do everything we said? No. Were you maybe doing things that were counterproductive to your body healing? Yeah. So that's why it's important that you understand the truth of what's going on. So there was a while ago, there's a study in New England Journal of Medicine, and the title was Emergency Department Visits for Adverse Events Related to Dietary Supplements. And they did a summary. They did 3,667 cases, and they estimated that 23,000 emergency room visits each year were the result of adverse reactions to dietary supplements. Now, you read that title and you go, that's a concern. 23,000 people went to the hospital because of dietary supplements. That's a big concern. They estimated that 2,154 hospitalizations annually, again, emergency room visits and then hospitalizations. They said that almost half of these incidents, this is a key statement, involved young people between the ages of 20 and 34 and children, proving, as they said, how dangerous dietary supplements are to the young and the healthy who are taking these products. Well, that sounds like a pretty big statement. And I'm reading the title of this and I'm going, wow, I don't know. I've taken supplements a good portion of my life. I have my own line of supplements. I recommend supplements on a daily basis, probably an hourly basis. This is a big news. I got to talk about this. And then there are a couple of spin-offs from it. A new study just revealed disturbing information about all natural dietary supplements. Health supplements send 23,000 people to emergency rooms. 20,000 ER visits every year, study finds. They were all spin-offs of the original study. So no one checked the facts or dug deeper into that study. And so what they did was they just wrote articles about the article, articles about the study. Now, let's talk about the truth. I'd be concerned if I saw that. I think you should be concerned if you saw that title too. Different magazines, like I said, did minor changes on it. So what does this all mean? Well, fact number one. First of all, emergency room visits don't mean deaths. I'm going to go somewhere with this. Hold on to this. Also, I don't know anyone, and I don't know if anywhere in the research anyone has ever died from taking dietary supplements the way they're supposed to. Now, if you took, and we're going to talk a little bit here about some of these supplements that men take for enhancement, yeah, those can cause problems. But so does the pills that the men take too, and women as well. 20,000 incidents of these, of whatever it was, 23,000. 20,000 of them were from elderly people who got the pill stuck in their throat and they couldn't swallow. So is that due to the dietary supplement? No. It's the fact that some people can't swallow pills. I have no problem. I can take a handful of supplements, swallow them, no problem. Other people come to me all the time and say, Dr. Joe, I love your supplements. They're amazing. I take the nitric oxide. I take the B complex, the adrenal support, but I have trouble swallowing pills. So what do I recommend to them? If it's a capsule, open it up and just put it in your food. Perfectly fine. Doesn't matter. If it's a caplet, put it in a food processor or in a coffee grinder and grind it up into a powder and then put it in your food. Perfectly fine. So the fact that you can't swallow the pill, 20,000 of these 23,000 people that went to the emergency room, they just couldn't swallow the pills and it felt like the pill was stuck. Now, if they can't breathe, that's an issue. But none of these, no one had any adverse effects. Eventually the pill dissolved or I drank some water and it went down, which was great. So a lump in the throat, I don't think counts as a reaction to the pills. Some people had events with palpitation, chest pains, tachycardia, and a lot of those people then mixed the pills with alcohol. Other ones were children who had access to supplements and they took too many of them. Well, if you give a child access to bleach or cashew nuts, maybe they shouldn't be taking that many. So once again, I wouldn't put that into something went wrong with the supplements. But here's the kicker. American Medical Association, prescription drugs are responsible for 76 to 137,000 deaths every year. Now, I am not against medication. I'm board certified in chiropractic, orthopedics, pain management, double board certified in nutrition, BS in nutrition, retired dietitian, award-winning author. I am not against medication. If you need medication, take it. I will take it if I need medication. My goal with this show and my practices and my books and everything we do is to try to give you options. Can we get to the cause of the problem so hopefully you don't need the medication? And we get referrals from medical doctors, hospitals, surgeons. Many times we don't even know these people. They listen to the radio shows, they read my books, and they'll say, well, you got to go see Dr. Joe. Let his team of doctors work with you. Because they say, we're kind of stuck. We've done everything. We know what to do. We're kind of stuck. See if Dr. Joe can help you. In many cases, we can. And then we co-manage the case. My team of doctors and I will work with you and your doctors to try to get the best treatment for you. Maybe it's chiropractic care. Maybe it's nutrition. Maybe your stomach is pushed up against your diaphragm. You're having trouble breathing, or you have sleep apnea. You're burping a lot. You're not digesting your food properly. And we can actually adjust or massage or pull the stomach down away from the diaphragm so that you can then digest your food better. So many times a healthcare problem is physical, not chemical. Understand that. As a chiropractor, we look for pinched nerves, 206 bones in the body. Any one of them can come out of place, including your skull bones. We can adjust your skull. How cool is that? So if a bone is out of place, we want to put the bones back in place physically to take the pressure off the nerve, and many times that relieves your pain. But here's the kicker. 90% of your nerves don't feel pain. So you can have a pinched nerve and not know it. But those nerves that are being pinched control your organs. So now you may have an organ problem that isn't responding, and it could be a pinched nerve going to the organ. And that's why we check that. And I never tell patients to come off their medication. I say, let's see if we can get you well enough that you don't need your medication. And doctors love it. Hospitals love it. Patients love it. Nobody loses. Everybody wins. Well, I guess you're on medication, you're selling medications. But I don't know of any doctor, and I mean this, I don't know of any doctor out there who is giving you medication on purpose when they know another option. And I would say hundreds, maybe thousands of other healthcare practitioners. And I don't know of anyone who's maliciously saying, ooh, let's keep you on diabetes medication because we have the secret answer, but we're not going to tell you. And I always laugh when I see topics like that. You know, doctors reveal secrets that they don't tell their patients. What benefit is that? That makes absolutely no sense whatsoever. So I digress. So no one I know of has ever died of supplements, and yet 76 to 137,000 deaths every year from taking medication properly. Taking the medication like it was prescribed. Because everybody's different. If you ever look at the side of it, let's say an aspirin bottle. We'll keep it simple. And it says take, 2 aspirin no more than 3 times a day. Maybe that's a dosage. But I weigh, 185 pounds. And there's another person who might weigh 350 pounds. Another person might weigh 100 pounds. There's not really dosage designed in many cases specifically for the person. Maybe you have a reaction to aspirin. I can't do aspirin. It has caffeine. Caffeine gives me a headache. Well, it doesn't say in there if caffeine gives you a headache, don't take aspirin. If I have a pain, I might take acetaminophen. Acetaminophen helps block the pain. Ibuprofen helps reduce the inflammation. They're two different things, acetaminophen and ibuprofen. Sometimes you got to take both. But in the process, I want to find out why I had to take the acetaminophen. Why do I have a headache? Well, is it a pinched nerve? In my case, I have an old injury at my second and third cervical, my first, second, and third cervical on the left side. And I was hit by a car when I was a kid, and I landed on my head. I was 10 years old in Germany. And I'm guessing that's when I jammed my neck. And now as an adult, this is a chronic issue. And I have to get chiropractic care to stabilize my spine because it's just something that's there. It is what it is. If I was diabetic, I would take my medication. And then I try to find out what can I do to stabilize my body so maybe I don't need the medication. That's why we work so closely with so many other doctors around the country. We get referrals from all over the world in our offices because we try to get to the cause of the problem, not just treat the symptoms. And I'm okay treating the symptoms while you're getting to the cause. So once again, I'm doing a comparative study here. Are supplements safe? The answer is yes, if they're the right kind, taking the right dosage. Same thing with medicine. But here with medicine, taking the right dosage, up to 137,000 people a year die. Again, I'm not going to say stop taking medication, but that's a pretty big issue. Following the rules. If you overdose or you take it wrong, that's not counted in that statistic. So if you're just tuning in, folks, I'm Dr. Joe Esposito talking today about are supplements safe? No supplements that I know of are inherently dangerous. Now, if they're taken the wrong way, you can have some real serious problems with them. And sometimes I've read studies saying that, well, there's no benefit to taking supplements whatsoever. And I read one article years ago, I think this is old school now, is that you just get expensive pee. If you take supplements, you're just getting expensive pee, and all you do is peeing out your supplements. Well, I don't agree with that at all, okay? So here we are, some schools of thought are saying that supplements are useless, and then here are other schools of thought saying supplements are dangerous because they're so powerful. Well, you can't have it both ways. If they're useless, they can't be powerful and dangerous, and if they're dangerous and powerful, they can't be useless because they're having some effect on your body. So once again, I go back to the statement that I said earlier. It's the quality of the supplement. Do you need that supplement? every day, no kidding, I've been in practice 34 years, patients come to my office and I'll have a bag of supplements. And I'll say, Doc, I heard that I need the CoQ10 is good for energy, and that whatever, the vitamin C helps your immune system, and B vitamins are important for your nervous system. And I look at their bag of supplements, and I check the quality of the supplement. Do you have a real good brand? There are certain ingredients I can look at right away and know if it's a good quality brand or not. Are you taking it the right way? And then do you really need it? Or are you just wasting your money? And that's a point that I like to make. And I try to work with the patients, my team of doctors, to try to get you on a good diet, to try to get a lot of your nutrition from your food. Supplements are just that. They supplement a good diet. They're not instead of a good diet. They're in addition to a good diet. And I found in all the years I've been in practice, if you can have a normally functioning nervous system, a normally functioning digestive system, and good nutrition, now you've got a healthcare plan. Most people have healthcare insurance, but they don't have a healthcare plan. And we're trying to put together a plan for you and let you know that if you are going to take supplements, which, by the way, I take them every day, and I think you should too, you want to make sure they're safe. I always take at least Dr. Joe's Super Greens and Dr. Joe's Essential Source. That's what I think is the minimum amount of nutrients anyone should be taking. And those are 2 powders. They're on my website, drjoe.com, also available on Amazon. Those are the minimum amount of nutrients you should take. And they're 2 powders. I take a jar and I shake it up with coconut milk, almond milk, or water. And with the coconut or almond milk, they taste great. Water, it's a little boring, but you know. And it's amazing. I can't go a day without at least the Super Greens and the Essential Source. I had a patient come in the other day, I was talking about supplements with him, and I am 20 years older than him. And he said, Doc, he says, as we get older, you and I, he says, we're going to have some health issues. And I said, what do you mean as we get older? I said, I'm already old. And he said, how old are you? And I told him, he says, Doc, you're 20 years older than me. He says, where do you get this energy from? He says, you do your radio shows, you run free practices, you have a social life, you do lectures, TV shows. Yeah, it's a lot of fun to have energy. And you get that by A, putting good food and supplements in your body, and B, not putting the bad stuff in your body. Then, of course, I relied tremendously on chiropractic care to make sure my nervous system is working at the top it can. And so he says, I want to be like you. I said, there's no reason why anyone can't be better if they have a normally functioning nervous system, normally functioning digestive system, good nutrition. Now, folks, if you want to make an appointment to come see us, I'm going to continue in a second. Go to my website, drjoe.com. In the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. We would love to have the opportunity to be your doctor. Not just for you, for your family, your friends, and your children. Please. If a child's spine is straight, they grow straight, usually. If they're crooked, they usually grow crooked. And the biggest complaint I get, and I get it every day in my practice, every hour in my practice, probably more than that, why didn't I do this sooner? Why did I wait so long? And every day, almost every day, I meet patients that say, Doc, I've been listening to you for 5 years, 10 years, 20 years, 30 years. I've been following your research, and it's amazing. And I've been meaning to come here. I said, what took you so long? I don't know. So don't wait, folks. If you have a healthcare problem, back pain, neck pain, shoulder pain, digestive issues, you want nutritional advice, please go to my website, make an appointment right now, drjoe.com. We'd love to be your doctors so we can help get you well and keep you well. So we're talking today about supplements and are they really safe? And we're talking about this one article that kind of disturbed me. It was written a while ago, actually, and this was something that pops up periodically. And 23,000 people a year end up in the hospital, emergency room visits. 20,000 of them are elderly people, can't swallow. Then there's children. And then the other one is young people that overdo things. And this is interesting. A while ago, I remember seeing a video on the internet somewhere, and a guy had drunk, whatever the right word is there, like 10 or 12 energy drinks. And he was in the emergency room, and his heart was literally pounding out of his chest. And that's real serious. So, yeah, there are certain supplements that might help with energy. I take Dr. Joe's B complex every day. We all need B vitamins. Most of us are deficient in B vitamins. I'm a vegan. I don't eat animal products, so I'm even more deficient in B12 than most people who eat animal products. So I take a B complex every day. It has B12 in it. I take Dr. Joe's adrenal support because as you get older, all your glands get weaker, but the adrenal glands produce energy, hormone levels, and fight inflammation. So I take Dr. Joe's adrenal support every day as well. I take, of course, Super Greens and Essential Source. There's another supplement we have that's extremely popular called nitric oxide. Nitric oxide opens up your blood vessels to your brain, to your reproductive organs. Get what I mean when I say that? So it increases circulation everywhere in your body. And the nitric oxide is, and those are some of the more popular ones. But we have in the winter vitamin D. And I get this question almost, 2 or 3 times a week on my Facebook, on my email, drjoe.com. Dr. Joe, vitamin D2 or vitamin D3? Absolutely positively vitamin D3. It's about 500 times more effective than vitamin D2. Vitamin D2 is synthetic. It has to be converted into vitamin D3. And many times with vitamin D2, it'll be recommended you take 50,000 units a week, one time. Well, your body can only absorb so much of anything, even water. So I like to spread out my supplements. So I take in the wintertime when I'm not getting sun exposure, 5,000 international units of vitamin D3 every day. Now, with the vitamin D3, we also add vitamin K2, and vitamin K2 is necessary for proper bone strength. If you want to have strong bones, you need K2, and that's one of the things that most people are missing. Most people don't get enough vitamin K. So we add vitamin D3 with vitamin K2. It's a liquid. It has almost no flavor. Take 5 drops. It's 5,000 units, and it's pretty awesome. If you've taken antibiotics, a lot of people have taken antibiotics in their life. And if you eat animal products, if it's commercial, many times you're getting low-dose antibiotics every time you eat the animal product. So what we do is we recommend Dr. Joe's probiotics then to help rebuild the bacteria in your colon. But the probiotics work because they're good bacteria, but you want to make sure you're getting prebiotics. Prebiotics feed the probiotics. And then the probiotics help keep you alive. So that's why it's important to eat fruits and vegetables. Because fruits and vegetables, especially vegetables, have prebiotics in them. Dr. Joe's Super Greens, Dr. Joe's Essential Source, prebiotics. So I formulated the supplement so that it's real easy for you. You don't have to know that this needs that and that needs this in order to work. It's all there. Okay? So back to supplements, are they safe? And one of the problems is that you have these kids drinking, young children, younger kids, multiple energy drinks, maybe double espressos to go with it, and now you've got a problem. So, remember years ago, I used to date a gal, and her favorite saying was, when people say anything in moderation, she'd say, moderation is for monks. She goes, I want extreme life. I don't want a moderate life. And in order to get extreme life, you have to make sure you're taking care of yourself. So the question back to supplements are prescription drugs, we said 35 times more likely to send you to hospital in supplements, astronomically higher risk from taking prescription medications than supplements. Again, I know of no one who's ever died of supplement overdose taken properly. 28% of those young people abusing energy supplements and dietary pills, 28% of the people that are hospitalized. So they're taking energy pills. And yeah, now a trend is you take an energy drink and then you mix it in with some alcohol. So you stay awake and get drunk, just what I want, an awake drunk, even more pleasurable than a sleeping drunk. And that can cause some serious problems. So you probably don't want to do that. 37% result, we said, from seniors trying to swallow pills and have trouble swallowing pills. So when you break it all down, 86% of the incidences cited cover mess-ups. I don't want to say stupidity, but mess-ups. Leaves 280 incidents and 3 hospital admissions a year among 150 million users. So that's not bad. I mean, in all reality. So could there be a reaction? Yes. Is it rare? Extremely rare. I wish food was this safe. Centers for Disease Control estimates that every year, roughly 1 in 6 Americans, or 48 million, will get sick, 128,000 will be hospitalized, and 3,000 foodborne illnesses will kill you. So food isn't as safe as supplements. How bizarre is that? Not even close, like infinitesimally different. And so supplements are pretty safe when taken in the right amount using the right supplements. That's why with our patients, we always put together a supplement protocol along with their chiropractic protocol, along with their medical protocol. We send out patients for MRIs, CAT scans, neurologists, neurosurgeons, urologists. I have a urology team I work with. They send us a ton of patients because they say, Doc, we checked the pelvic area, we checked the urinary issue. It's not an organ issue. What else can it be? It's probably a physical issue, a pinched nerve, a muscle spasm. You guys take a look at it and see what you can do. And so the supplements are very safe and extremely effective when done properly. So, folks, if you want to make an appointment, I've got to go to break. I'm coming right back. A lot more to talk about on supplements. If you want to make an appointment to come see us, go to my website, drjoe.com. In the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. We would love the opportunity to meet with you. We want to check your nervous system. Do you have neck pain, back pain, shoulder pain, numbness, tingling, headaches? Find out why. And if we can find out why, then hopefully we can fix it. And if we need co-management, we take care of that. If you've ever been in a car accident, ever, if the car was damaged, you were damaged 100% of the time. And almost every day, I guess, in our offices, a patient comes in and says, Doc, I was in an accident. Check me out. I want to make sure I'm okay. I didn't have any pain right after the accident. Almost 100% of the time, we find something wrong. And then they go, Doc, I'm so glad I found this early on. And then patients on the other side come in, after the accident and go, I'm in a lot worse shape. I wish I'd come in earlier. So, folks, if you want to make an appointment, want to order supplements, drjoe.com. Supplements and books are also available on Amazon. Folks, I'm Dr. Joe Esposito. Once again, thank you so much for listening. I really appreciate that. Tell your friends about the show, and we'll catch you next time. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on a WSB Radio app.